if you look into these exoskeleton courses. So lots of factors needed to be taken into account: the weight, height, structure, the ergonomics, mechanical aspect, signal processing aspects. Then of course machine learning is there. So every part of it. So the thing is that but our approach is that we will not change our environment. Some person disability is a tragedy, and then we will fix up the person, right? And if you recall the first story that I wanted you to read about, named the unspeakable conversation. So even Harriet, when he is conversing with philosopher, uh, I forgot the professor's name. I think Peter something. So yeah. So then the same thing is coming. Like he her state is considered as a very tragic state, and even the eugenics was brought into the discussion, that whether this kind of children, because it is thought that children who has disability are going to lead very tragic life. But the question is why they will face the challenges? They should not be. That is not a shortcoming on part of them, but it is onto us. Okay, so this medical model and the tragedy or charity model. So the next time you think a person with disability as a very tragic person, of course they are facing difficulty, they are barred from regular participation, but that is not because disability is a tragedy, because we haven't taken necessary steps to make our society inclusive, and that is the actual tragedy. And then we go to the economic model of disability. So now the thing is that with the modern times, with the industrialization, how was the ability of a man who was described, that his the ability to participate in the productive work, right? Uh, like to contribute to production of certain commodities, putting into certain the hours, kind of do the work and earn the wages. So things like that. So at that time also disability was viewed from the perspective of economic model. So it defines disability by a person's inability to participate in work. It also assesses the degree to which impairment affects an individual's productivity and the economic consequences for the individual, employer, and the state. Such consequences include loss of earnings for and payment for assistance by the individual, lower profit margin for the employer, and the state welfare payment. So this model is also directly related to charity or the tragedy model. So basically in this model what we are saying, that if a person cannot due to disability, if a person cannot contribute to the work, then basically you will see uh, this kind of discussion also goes on, like whenever, like, why should government support uh, persons who cannot access healthcare? Why should we spend money behind the people who are not contributing to the workforce? So this economic model sees a person with disability as a person who is not able to participate in the production process and through which revenue is earned. Okay. Then we have, and okay, so one thing is that these models are not not kind of a sequential timeline. So broadly say, after moral model came charity model, but does not mean that the model ceased to exist, because the models are existing outside outside the academic space, right? They are existing actually in public perception, in society. So lots of time multiple models they can coexist simultaneously to shape the perception about disability. Then the what expert or professional model does, this model has provided a traditional response to the disability issues and can be seen as an offshoot of the medical model. Within its framework, professionals follow a process of identifying an impairment and its limitations using the medical model, and taking the necessary action to improve or quote unquote normalize the position of the disabled people. These has tended to produce a system in which an authoritarian, overactive service provider prescribes and acts for a passive client. So, in another the word, this expert or professional model, it does not treat persons with disability as independent is the individual. It kinds of sees persons with disability as having some medical problems or some kind of impairments or disease, and it and it kinds of it assigned a professional or a a caregiver to the person with disability, so that this person will take all the decision on behalf of that person. And on behalf does not mean in consultation with, because in this case it is saying that the persons with disabilities are mostly not capable of taking important decision by themselves. So it kind of directly undermines the independence of a person, and it is kind of very indignified, right? So any question till now? Okay. So now, after all these models came after years of disability activism, lots of debates, lots of fights for rights, we had this social justice model of disability, like social model or justice model. What is this? The social model of disability sees the issue of disability as a socially created problem and a matter of the full integration of individuals into society. In this model, disability is not an attribute of an individual, but rather a complex collection of conditions, many of which are created by the social environment. Hence, the management of the problem requires social action and is the collective responsibility of society at large to make the environmental modifications necessary for the full participation of people with disabilities in all areas of social life. The issue is both cultural and ideological, requiring individual, community, and large-scale social change. From this perspective, equal access for someone with a variation is a human right issue of major concern. So take 10 seconds and read through it once more. The person you are calling is not answering. Please. Okay. So what social models say is for the first time we see the model is not defined around the individual, not about, it is not about the impairment of the individual or any other shortcomings of the individual. The model starts with how our society should be structured so that a full integration of person with disability or someone with any kind of variation is possible. And it says that the challenges that an individual with disability faces, it is created by the social environment, and it is the collective responsibility of the society at large to make environmental modification necessary. So a person with disability may or may not use any piece of assistive technology, may or may not use any piece of intelligent prosthetics, any piece of any kind of transplants or things like that. They may well use, may not use, but that like our interventions of on disability should not be contingent on that. We need to say, we need to have a building always with RAM. Not, we cannot depend on the fact that a person will always have some kind of prosthetics, that if they do not have a limb they will be able to climb up the stairs. So the thing is that irrespective of whether the individual is using a particular piece of assistive tech or particular piece of interventions for disability, our environment should be modified so that the structure, the design, the facilities are inclusive of all. So we will see more to this in the when we discuss the universal design. So, and it recognizes that this issue is both cultural and ideological. Cultural from the point that we as a society, we are accustomed or habituated to a particular way of functioning. It will not change overnight. Just because we say that every building should have facilities for persons with limited mobility to move around, and not only ramp will always suffice, because not all person who has some physical disability, they always use wheelchair. What happens if someone is only using a crutch or a walking support? Then the buildings should also have some lift facilities, right? um, so what happens, so when a person with the visual impairment cannot see, so if you see that these days we have our train compartments, like the train bogies, they have lots of braille the indentation above the seat numbers, and while going into that particular compartment, or even our the ATM machines, it now has the braille braille transliterations with the different functionalities. But the thing is that it does not end there, right? Just installing something with a braille functionality will not magically solve problems with people with visual impairment, because what, first they need to go to that ATM or go to the train station. And I think you all have very well idea that in an Indian railway station, if you cannot see, navigating just based on what is being said over the loudspeaker is very difficult to do, right? Particularly in big junctions. Okay, so it is also a cultural thing that lots of time we see, we does some interventions, but very uh, which is not which are not comprehensive or not connected to each other. So at the end, they do not actually make the environment really inclusive. And the second issue is also ideological, that see, all these models that we have seen, this tragedy model, medical model, moral model, they are still there, right? The perception, like the most dominant perception, that when we give some help to a person with disability, we do something good, will not go away. So unless we understand it from the human rights perspective, and that don't also happen to over a day or overnight, or even sometimes people are not ready to see it from that side. Because see, if we say someone isn't tragedy and whatever we help we do good, then actually we are feeling good. But now if we think like this, that person is in a bad state of is in a does not have a proper good life because we have not done our duty. This is not very easy to accept for many people, and we have our own problems as well. So this requires a large scale social change. And for the social in the social model, first time disability was also defined as a human rights in the issue. So it is related to the civil rights model of disability. Okay, so initially the social model, it also tries to break the biomedical chain of causation, because till now we had the perception that for disability impairment is absolutely necessary. Now impairment, I am not saying in the sense that say if someone is born of cerebral palsy, of course, like you can say, madam, if there is a reading disability, we are seeing that they have a neurobiological foundation. So isn't it some kind of impairment? So in this case, impairment is in the sense that in relation to the medical model. So the impairment that should be fixed up. So it tried to break that causation change. That disability is always the underlying condition of disability is not always, quote unquote, an impairment that should or can be fixed up. But while social model redefines disability, is also stopped short, like is tried to break the chain, but is stopped short of questioning the status of impairment. So till now, how we understand disability is impairment is a necessary condition for disability. Impairment is a real entity, a condition of the body which remains the exclusive domain of medical interpretation and or intervention, and it minimizes the experience of impairment. So the focus, like whenever we say that there has to be some impairment, so the focus is on a medical diagnosis, because impairment is in a very specific concept of medical interpretation and intervention. So what happens, we focus so much on the impairment, the experience of the person with disability, that takes a backseat. But we are saying that the experience is important. Even if we can help a person who say have lost eyesight due to some medical reason to see again, the experience don't go away. Okay. So for that reason, with all these models, from all the models, we actually take, so what a model tries to do, define disability. Okay, describe disability. Now we will take a different path, that instead of describing what disability is and what disability isn't, why should we take, why should we think about how we should approach disability? Just give me a second. Okay, fine. So a person has some disability. Now, what should be our approach at individual level and at a societal level? Mostly at a societal level, like where we can influence in a large scale how we should approach disability. So this in present days, the approach is called the rights-based approaches. So the United Nations has a convention, has a document which is called the United Nations Convention for Rights of Persons with Disabilities, the UNCRPD. Just give me a moment. So the document, the UN CRPD, it was it was finalized in 2006 and the nations ratified it in 2000 in 2008. So the UN CRPD or United Nations Convention on Rights of Persons with Disability is a very important document because this is one of the 9 charters on human rights issues uh, by the United Nations. So this also goes to point the importance of rights of persons with disabilities. That the particular right, there are some charters like rights of children. Uh, and there is the Human Rights Charter of United Nations. So these rights of persons with disabilities, it is one of those 9 charters which kind of are like mandates on the human rights. So what right-based approaches says that all human, now it views disability from the perspective of human rights. It says all human beings, irrespective of their disabilities, like, so you can add like irrespective of their anything, have certain rights that are inalienable. That is what we call the fundamental human rights. So they deserve respect and have human and legal rights protected by law that must be upheld. And discriminating against people with disability is illegal. So if you see, this is a very different approach from the other models because there we are concretizing that what should be our specific approach towards disability. Okay, whatever we think that a person has a tragedy, the person has a medical condition, the social model, but they always have the equal rights which are inalienable, which we cannot change just because the person has disability, and this must be upheld. And this is illegal if there is a discrimination against persons with disabilities. So what in case of the education, that did like it just an example case. The rights model emphasizes the rights that students, staff and faculty with disabilities have in any educational or employment environment. These includes the rights to be free from harassment, discrimination and hate, and accessible the environment, because as we have seen from social model to rights based approaches, now the onus is not the individual with disability to adjust, but rather on us to have an accessible environment. And then academic and workplace accommodations, and of course just like any other person, they also have a right to privacy of personal and health information. So generally we do not understand the privacy part in our society, and we will see like medical records, diagnosis, or even other personal data like changing hands very freely and without any kind of safeguarding or without any consideration about the individual might feel. But these are the fundamental human rights. Okay, so when we see disability from a rights-based perspective, our focus shifts from what problems, like quote unquote problems the individuals have, to the part that where we should make modifications to our environment so that all the human rights of that individual is upheld. So in this case, seeing the problems as internal problems and to diagnose and fix up the individual, we see the external barriers that the environment has, and we try to remove those barriers so that the individual have no problem to navigate in the environment. So instead of changing the individual, now we are concentrating on changing on uh, the environment. So as you can see, so earlier we used to think like this, that a person is insane, has disorder, defectives. sick, abnormal, we need some diagnosis, he has some mistakes, he is a broken person. Now we concentrate on the external barriers. That is, okay, if a person cannot walk, the actually the barriers are the physical architectural barriers, and we see that like all no provision of ramps or elevators for person with hearing impairment, poor sound quality, or lack of accessible to washrooms or the all gender washroom. Because when we are describing disability as a human right, now we also need to think about the intersection of disability with other human rights concerns or other minorities also, other sexual, gender, ethnic, racial minorities also, because every one of these experiences are unique. So then when we see that a person, when we say that, sometimes we find out that that person has some problem, like he cannot understand, he is insane, although there is no clinical diagnosis of insanity done on that person, but we just say this kind of thing because the person may not be able to communicate properly. So now in the right based approaches, we see that what kind of communication barriers are there, why the person is having difficulty. Instead of saying the person that you make yourself up to the mark of communicating in academic jargons, we concentrate on whether we are using the jargon so heavily, or we are speaking too quickly while teaching or while describing anything to any of your friends, that whether this is giving rise to an information or communication barrier. Similarly, we see that if a person is not able to access certain pieces of technologies or not able to access certain pieces of information, are there some technological barriers, that the documents are incompatible with screen reader, lack of ability of teletypewriters. So nowadays we don't use teletypewriters, but just like to convey the importance of technology, and for typing communication by phone rather than speaking. And what kind of organizational or systemic barriers are there, that kind of fees and less accessible classroom, less acceptance. When we see inclusive education, we will also discuss that why we still need to have this special school and why persons with disability cannot go to the regular schools till now, although it is mandated by law. Because although we have a law, to actually implement, we need the kind of acceptance or from the society too, right? And then the important thing is the attitudinal barriers towards disability. So often, as we discussed, like when we were seeing the STEM education in person with visual impairment, it is not that the person with visual impairment, they are less intelligent than those of us who pursue STEM. It is more like the attitude that, okay, if a person is blind, what will they do by pursuing science or mathematics? उसको scientist थोड़ी बनना है, उसको वो engineer थोड़ी बन पाएगा. And actually we have this attitude that every other discipline of study than science, engineering and mathematics are, people don't have to put any effort on that. They just go to their examination hall, write some stories and get marks, right? We have these things, like particularly we look down upon the social sciences things and all, and we have a belief that everything will be solved with data science one day. So these attitudinal barriers also, like, it have the pathologizing attitude that see disabled students, staff and faculty as less capable or qualified to participate in university. That's why we do not have only less disabled students, we also have less disabled staffs and faculties. So now with right-based approaches, we shift our focus from this side from internal problems on the individual to actually the external barriers. Those are in place, uh, uh, blocking an inclusive environment, and we see these barriers as a human rights violations for the person with disability. So what is most important to remember is that we all are different and need to be recognized for that which we are capable of doing, not for what we may require aid to accomplish. Okay. So disability is not about what you need in help to accomplish. It is to acknowledge that we all are different, and some of us can speak, some of us cannot speak. Okay, just an example. So any question till now? Yes, no? No question?
No, ma'am.
Is anyone even listening?
Yes, ma'am.
Because if someone would have listened, they would have quickly said yes, just to shift focus from them. Okay, we are almost at the end of the class. We will, I will just take, 5 more minutes. Resharing the. So after we have discussed the different models of disability, we will look into some disability statistics. So this is census of India 2011. So actually, as you know, we have census once in a decade, and the 2021 has had to be postponed due to the COVID and all these reasons. So generally over worldwide, actually the thing is that you will see the number, like the census numbers in India are much lesser than the world the world statistics. There are some reasons, we will come to that, but in general it is assumed that the 15% 15 of world population live with some form or other disabilities, and a significant size of them with multiple disabilities. Now in case of India, you will see it is roughly at 3%. Now there are certain things. First, whenever we measure some statistics, it also depends on how we it also depends on how we define the categories. So we will see that in our 2011 census there were some disabilities, those were not explicitly addressed and counted. So this is one part, that where we need to describe the groups better to have a much accurate count. Another part is that in India, it is also said by lots of time the disability rights activists that the families also, they don't report if they have a family member with disability. It can be due to that they don't want to acknowledge that they have disabilities. It's something like dyslexia. Actually, unless until very recent times, till when dyslexia is started to be considered as a disability and extra time in examination hall is being given, before that, parents were very reluctant to get their child diagnosed as a child with dyslexia. It may be due to social stigma, maybe due to the added burden. See, most of us in our country, most of the parents are already overburdened with a lot of things like livelihood, sustenance, then the education and financial things. So it is not to put, the blame on anyone, but the objective is to understand the complex nature. Like whenever we look in the count, behind count we also need to take care of the social and the cultural factors that have influenced the count. Another thing is that the family member with disability, so they were also not report because you know, as simple as they are forgotten. So I have spoken to one of the disability one of the person who works with persons with disability, and he said that there was a child with cerebral palsy when he was kind of identified and brought into the center for cerebral palsy at 17 years of age. Till 17 years, that boy spent just lying on the floor of his house, like not a very well-to-do household, floor of his house, just in a room. 17 years, not so, because there is no infrastructure support to take care of that person with severe cerebral palsy. So it happens that people don't report, like they are not simply counted, the family members. Okay. But anyway, we again have, but even if we go by these 3% as the absolute number, we have a population of how much? Anyone? We have a population of what? 135 crores.
4 crore, ma'am. 4 crore.
What?
Crore.
Yes, in how much crore?
138 crores.
4.
Uh, 4 is not even the population of West Bengal. What are you saying? Yes, 135. So
138, ma'am.
38 now. See, okay. So 3% of that, how much it will be? Almost 4 crore. Yes, someone said 4 crores is a person with disability. Sorry, I didn't understand. So almost 4 crores. So 4 crores person, even going by the very conservative estimate, it is not a small number, right? Those who are still excluded from lots of important facilities and public places. So in 2011 census, we see that there are total 2.21% of persons, and of them, like almost the ratios are equal. And in the rural cases, the male-female ratios are also almost equal. But in urban, we have more disabilities in male. And then in 2001, we had the total disabilities at 2.13%. So roughly again near about the 3% thing. But if you see, the urban disability has grown in these 10 years to a great extent. So basically, we have a decadal change. Like we have almost in the absolute number, we have a 22% of decadal growth in 2001 to 2011. So we can safely assume that it will be at least this 22 or 23% decadal growth from 2011 to 2021. So the actual numbers are quite higher. The nowadays, which we do not have the exact data, but the urban disability actually rose by almost 50%. Okay, so the reasons are thought of as like more people from the rural area are coming to urban area for like migrating to urban places for sustenance and livelihood, and they have to take up many hazardous jobs, like working in stone factories, working in big buildings. So hazardous mean chances of accidents, and as you all know, like when a person, so we have very we almost always never have any kind of safety gears in place. Not only in construction, you will see the multi-story buildings are coming up with people just making a frame out of the bamboos, right? which is very unsafe. And then also people are working in the stone factories, the stone mines, without any mask, gloves, and the safety gears, without any hazard gear. So in the long term, they are affected by the diseases like silicosis and things like that. So the thing is that due to the hazardous living condition, due to the poor health condition, due to absence of nutrition while in the fetuses, the there can the urban disability is increasing at a much higher rate than the overall disability. So this is just an interpretation. Obviously, there is no specific answer to that. So we will continue with the disability statistics a bit more next week. So any question till now? Yes, no? I will end
No,
up.
ma'am.